Hi, I'm Tatiana the doula, and I'm continuing on with the notes reading. This is Notes 3B. This is actually handout number 6 of all of 9 handouts that I am going to power through. Probably won't read more today. I'll see how I feel. But some of these packets are many pages long and can take about half an hour to 45 minutes to get through. And that's reading at a normal level. And then also, like, I have gone through and highlighted some things or made additional notes on top of the notes. So just know that if you are going through these packets, these notes, that they will take you at least half an hour to get through, around half an hour, and maybe as many as 45 minutes. And there are 9 packets. I on the 6th packet, or the 6th handout of all the packets, and this is Notes 3B. We realized that lactation care providers, LCPs, and others needed to learn more about solving latch problems, so we operationalized this into the LAT tool for assessment, continuity of care, and to direct individualized corrective interventions. Infant states after the first hour. Deep sleep, don't attempt feeding. Light sleep state, rapid eye movement, REM, happens about every 27 to 30 minutes during sleep. Quiet alert, still body, fixed eye focus. Active alert, growing restlessness with hand to mouth activities. Open-eyed with rooting. Crying, change in state is needed before attempting feeding. Sleep-wake cycles in the first hours. All babies had at least a 1 hour awake time after birth. After the first hour, wakefulness varies. Feeding cues. A study of 24 to 48-hour-old babies indicated that rooting was the most common first behavior, followed by hand-to-mouth movements. Babies show more cues when they are close to the source of the milk. When cues are missed or state is not optimal, infants fret or sleep at the breast. Solution: skin to skin and reteach feeding cues. When the baby is in the optimal state for learning and feeding, the baby will have long periods of concentration, usually during REM and quiet alert. The snuggle poem. Tummy to mummy, nose to nips, flex the hips to open the lips. An RCT of side lying versus laid back for mothers. RCT is a randomized control test, I believe. Randomized control trial. An RCT of side lying versus laid back for mothers who were post-cesarean indicated no difference in breastfeeding outcomes. However, there was greater satisfaction with comfort, ease of positioning, and breastfeeding for long periods in the side lying group compared with the laid back group. First, line up the nose to the nipple. Then move the baby back an inch or two. The baby should gape. Repeat as needed. As the baby is moved toward the breast, the head tilts back. A hand should not be on the back of the head in order to allow for the head tilt. The bottom lip and chin reach the breast first. The nipple will then align with the upper half of the mouth. When the baby is latched optimally, there is more of the lower part of the breast drawn in. Nose and chin should be close to breast. The angle at the corner of the mouth should be at least 140 degrees. The baby's tongue takes up half of the mouth, so a wide angle is needed for room for the nipple to stretch in the top half of the mouth. Both lips should optimally seal. The cheek line should optimally be rounded cheek line, not broken cheek line, not dimpled cheek. During feeding, the cheek stays round and full. Bursts of 1-to-1 or 2-to-1 in an irregular pattern indicate a nutritive suck. The baby looks off-center. This is the asymmetric latch. With the asymmetric latch, more of the lower part of the breast goes into the baby's mouth. Rocker motion is optimal. Piston motion is not optimal. The baby should end the feeding with hands relaxed. And I know that I just said that most of these packets would take half an hour, but this one was 2 pages, 1.5 pages, and done. So yeah, this is the end of the reading for section 3B. So thanks for listening.